A 72-year-old grandmother named Evelyn stood in the pharmacy holding 2 prescriptions. The pharmacist said the total was $387. Evelyn had $140 in her checking account. She looked at both bottles, one for her heart, one for her diabetes, and made a decision she never thought she'd have to make. She chose one and left the other behind. That night, Evelyn didn't tell her daughter. She didn't tell her doctor. She simply started cutting her diabetes medication in half, hoping her body wouldn't notice. 3 weeks later, she collapsed in her kitchen. When the paramedics arrived, her blood sugar was dangerously high. At the hospital, doctors asked the question that broke her. Have you been taking your medications as prescribed? Today, on Wise Seniors, we're talking about something millions of seniors face, but rarely admit out loud. When you can't afford your medications anymore, what do you do? This isn't a conversation about shame, it's a conversation about survival. And before we go further, make sure you subscribe to Wise Seniors, because what we're about to share could quite literally save your life or the life of someone you love. Here's what doctors and researchers have discovered. 1 in 5 seniors over the age of 65 either skips doses, delays refills, takes less medication than prescribed, or doesn't fill a prescription at all because of cost. That's not a small number. That's millions of people. Nearly half of all adults over 50 have either skipped filling a prescription themselves or know someone who has. And here's what makes this crisis so dangerous. It's silent. Seniors don't talk about it. They don't tell their doctors. They don't tell their families. They suffer quietly, believing they're the only ones struggling, believing that admitting they can't afford their medications means they've failed. Evelyn later explained it this way. I raised 4 children. I worked for 40 years. I never imagined I'd be standing in a pharmacy deciding which disease to treat and which one to ignore. If you or someone you love has ever felt this way, stay with me, because what I'm about to share are 7 things doctors say you must do immediately if you can't afford your medications. These aren't theories. These are real, proven strategies that have helped millions of seniors get the medications they need without sacrificing their dignity, their savings, or their health. Strategy 1. Call Social Security about extra help immediately. The first thing doctors say you must do is apply for a program called Medicare Extra Help. This program is also called the Low Income Subsidy, and most seniors have never heard of it. But here's what it does. It helps cover the cost of Medicare Part D prescription drug premiums, deductibles, and co-payments. The average value of extra help is about $500 per year. For many seniors, that's the difference between taking their medications and skipping them. Eligibility depends on your income and resources, but the limits are higher than most people think. You don't have to be living in poverty to qualify. You can apply online at socialsecurity.gov, by phone at 1-800-772-1213, or by visiting your local Social Security office. The application is free, there's no shame in asking, and if you're denied, you can reapply if your situation changes. Evelyn applied for extra help after her hospital visit. She was approved within weeks. Her medication costs dropped to less than $10 per month. She says now, I wish I had known about this years ago. I suffered because I didn't know help existed. And as we continue, remember to subscribe to Wise Seniors, because understanding these programs can mean the difference between health and crisis. Strategy 2. Know about the 2025 out-of-pocket cap. Starting in 2025, Medicare Part D has a new rule that many seniors still don't know about. There is now a $2,000 cap on annual out-of-pocket prescription drug expenses. Once you've spent $2,000 in a calendar year on covered medications, you pay nothing more for the rest of that year. For seniors taking expensive medications, cancer drugs, biologics, specialty treatments, this cap can save thousands of dollars. Some seniors will save $3,000 or more every year because of this change. Additionally, Medicare now offers a payment smoothing option. Instead of paying large amounts all at once, you can spread your out-of-pocket costs into monthly payments throughout the year. This prevents the shock of a $400 pharmacy bill in January that many seniors can't afford. Doctors emphasize that if you're on Medicare Part D, you need to understand this cap. It's new, it's powerful, and it protects you from catastrophic drug costs. Strategy 3, search for state pharmaceutical assistance programs. Not every state has one, but many do. State pharmaceutical assistance programs, or SPPs, help low-income seniors and people with disabilities pay for prescription drugs. These programs often provide what's called wraparound coverage, meaning they pay costs that Medicare Part D doesn't cover. To find out if your state has an SPAP, visit medicare.gov and select your state from the drop-down menu. Some states limit these programs to people with certain conditions, like HIV or diabetes. Others have broader eligibility. These programs exist because states recognize that medication costs can devastate seniors on fixed incomes, but most seniors don't know they exist. Awareness is everything. Before we move on to the next strategies, take a moment to subscribe to Wise Seniors. These resources can protect you from impossible choices. Strategy 4, contact the drug manufacturer directly. Here's something most people don't know. Many pharmaceutical companies offer patient assistance programs, or PAPs. These programs provide free or low-cost medications to people who can't afford them. Each company has its own eligibility rules. Some programs are for people without insurance. Others are for people whose insurance doesn't cover a specific medication. Some have income limits, others don't. You can search for these programs at websites like needymeds.org, rxassist.org, or medicare.gov's PAP database. You can also visit the manufacturer's website directly and look for terms like patient assistance or financial support. Doctors stress that you should never assume you don't qualify. Apply anyway. The worst they can say is no, and the best they can say is yes, which could mean free medications for months or even years. Strategy 5. Use prescription. Discount tools and programs. There are several legitimate discount programs that can reduce medication costs significantly, even if you have insurance. GoodRx is one of the most well-known. It provides coupons that can sometimes offer prices lower than your insurance copay. Cost Plus Drugs is an online pharmacy founded to offer medications at cost plus a small markup. For certain drugs, the savings can be dramatic inside Rx, and other manufacturer-supported discount programs can help people in high deductible plans or those paying out of pocket. Additionally, ask your pharmacist about your insurance plan's preferred pharmacy program. Some insurance companies have agreements with certain pharmacies to charge less for prescriptions. These tools won't work for every medication, but for many common drugs, they can cut costs by 50% or more. Strategy 6. Talk to your doctor about alternatives. This is critical, and it's something Evelyn wishes she had done sooner. When you can't afford a medication, tell your doctor immediately. Don't hide it. Don't feel embarrassed. Your doctor needs to know. Why? Because there may be alternatives, generic versions, therapeutic substitutes, lower cost drugs in the same class, different dosing strategies, samples your doctor can provide temporarily while you figure out a long-term solution. Doctors cannot help if they don't know, and most doctors want to help. They understand that the most effective medication is the one you can actually afford to take consistently. Skipping doses or cutting pills in half without medical guidance is dangerous. It can make your condition worse. It can lead to hospitalizations that cost far more than the medication ever would have. We're almost at the final strategy. Make sure you subscribe to Wise Seniors so you never miss life-protecting information like this. Strategy 7. contact your local area agency on aging. Every state has area agencies on aging. These are local organisations designed to help seniors access resources, benefits and support. Many people have never heard of them, but they exist specifically to help with problems like medication costs. You can reach the Elder Care Locator at 1-800-677-11116. They will connect you to your local agency, which can help you apply for programs, find financial assistance, and navigate the often confusing world of healthcare benefits. There's also a free tool called Benefits Checkup at ncoa.org. It's a confidential online service that screens for federal, state, and private benefits you may be eligible for. It takes about 10 minutes and it could reveal programs you never knew existed. These agencies are funded to help seniors. Using them is not taking charity. It's accessing the support system that exists precisely for situations like this. What makes medication cost so devastating for seniors isn't just the financial strain, it's the emotional weight, the feeling of invisibility, the sense that after a lifetime of contribution, society has left you behind. Evelyn said something that stayed with the doctors who treated her. I felt like I had become a burden. I didn't want to ask for help because I thought asking meant I had failed at life. But doctors, researchers, and advocates all say the same thing. You have not failed. The system has failed you. And while we wait for the system to improve, you must protect yourself by using every resource available. Skipping medications doesn't just risk your health. It increases your chance of hospitalization, complications, and early death. Studies show that seniors who can't afford medications have worse outcomes across nearly every measurable health indicator. Medication costs should never force anyone to choose between health and survival. If you're in this situation right now, please don't wait. Start with one action today. Call Social Security about extra help. Search for your state's assistance programs. Contact the drug manufacturer. Talk to your doctor. Reach out to your area agency on aging. Evelyn is still here today because she finally asked for help. She takes her medications every day now. She says her only regret is waiting so long. She wants other seniors to know you are not alone. Help exists. You just have to reach for it. After 65, every decision about health becomes more important. Medications aren't luxuries. They're lifelines. And you deserve access to the treatments that keep you alive, active, and independent. Thank you for spending this time with Wise Seniors. If this message helped you or someone you love, please subscribe so we can continue sharing trusted, life-saving guidance that protects your health, dignity, and peace of mind.